Oh, you might have to take that off.
I was wondering.
Oh. Okay, I'm ready to start. So, hi, I'm Skylar. I'll be your nurse today. I'm gonna perform hand hygiene, obviously, get all clean. Can you state your name and date of birth for me?
Tanya Willis, 4570.
All right. And today I'm gonna be performing a head to toe assessment on you. So basically, just evaluating everything, all right? Do you have any questions?
Nope.
Okay, so first off, I need you to state, can you tell me where you are?
At home.
At home?
Okay.
Or, can you tell me who the President of the United States is?
Trump.
Donald Trump, okay. Can you tell me what year it is?
2020.
2020, oh, the year of years.
Yeah.
All right, and so far, can you tell me why you're here?
Just to get a checkup.
Checkup, yep. So far the patient is well-developed, well-nourished, 50-year-old female. Speech is coherent and clear. There is no wheezing or anything that is noted. And the patient is alert and awake and oriented ×4. So next what we're gonna do is we're gonna test muscle strength in various parts of your body. So I'm gonna have you push against my hand. Okay, push against my hand. Push against my hands. Good. And then I'm gonna have you squeeze my fingers as hard as you can. Good. All right. Now I'm gonna have you push up on my hands. Push down. All right. Now push out. And push back. There goes the table. Okay. And then I'm gonna have you push on my hands like you're pushing the gas pedal. Good. All right. And so the patient's muscle strength is 3 out of 5 on a scale of 1 to 5, and it's symmetrical, strong, and bilateral on both the upper and lower extremities. Next, we're gonna test your sensation. So what I'm gonna be using for that is a cotton ball, and I'll use this for the sharp end. So what I'm gonna do is I'm gonna touch different parts of your body. So like your right upper arm, your right lower arm, and it's either gonna be soft or sharp. I'm gonna have you close your eyes and you're gonna have to tell me which one it is, okay? All right. So, which part? Which part of the body?
Oh, upper arm.
Upper arm? What arm?
Right.
Right, okay.
Sharp.
What part of the body?
Lower left arm.
Okay.
Sharp.
Okay. What part of the body?
Lower right arm.
Right arm? Okay.
Soft. Upper right. Upper left.
Nope, yeah. Okay, next. All right.
Hard.
Okay.
Lower right leg.
Okay.
Hard. Lower left leg.
Good. So the patient's sensation is symmetrical and intact bilaterally on upper and lower extremities. Next is the fun part. We're gonna test reflexes, okay? So we're gonna start out with I'll go over this arm so that way they can see it. All right, we're gonna test your triceps. So I'm gonna hold your arm like this. Just go ahead and let it hang loose. Just gonna give a little tap right here, okay? Good. All right, now we are going to do the other side because we gotta test both. Yep, just let your arm dangle. Okay. Next, we're gonna do the biceps. So I'm gonna like cradle your arm. I'm gonna put my hand right here, tap my thumb. Oh, wow. Okay. Next arm is gonna be this one. Kind of difficult to do this. Okay. Now we're gonna do your radius. Just right here, tap. Here. Wow, I actually got this. Okay. And then we are going to do your knees. So you wanna have your foot dangled so that way I can get it.
Swap sides with the chair. I don't want to let go of the chair.
Okay. All right. There we go. Gotta do the other leg now. Sorry, our table is not stable. Where is it? Right here. Okay. And then can you take your slippers off for you? Yes. Perfect. All right. I'm gonna test your ankle reflex. So I'm gonna test right back here. Okay. This one too. Okay. And then we're gonna do the Bushinski one, which I'm gonna like brush this on the side of your foot like this, so it might tickle.
Oh, okay.
All right. Okay. And for this one, you don't really want a response because it's more normal in children to have that response. So, all the patient's deep tendon reflexes are intact, including the Bushinski. All right, so the next one, I'm gonna have you stand up for me, actually. All right, so I'm going to have you walk in a straight line, taking 5 steps forward. Okay, now I want you to walk back like on your heels. Good. Now turn around and we're gonna do on your toes this time. Good. And then coming back, we're gonna do heel to toe, so like a sobriety test. In a straight line. As best as you can. Good. All right. So the patient's gait is good and intact. I'll have you take a seat again, Mr. Willis. Good. All right. So next we're gonna do is called the HEAT. So head, eyes, ears, nose, and throat. So we're gonna start out. I'm gonna feel your head for any abnormalities. Nothing, no scarring or anything. Is there any pain when I touch you there? No. Okay, now we're gonna check your eyes. Can you lift your glasses up for me so that way it doesn't get the glare? All right, so just follow the light. Good. Good. I'm gonna put my hand right here, and you don't have to follow it. You can just keep your eyes there. I'm just looking for your pupil response. Good. Both pupils constrict at the same time. Now I'm gonna have you follow the pen light. Good. Accommodation is good for this patient as well. Moving on, we are going to do your nose. I'm just gonna look for any nasal flaring. There is not, so there's no signs of respiratory distress. Take a better look at your nose. Mucous membranes are intact. There's some hair in there, but it's all good. Now we're gonna do your mouth. So can you open up for me? Good. Mucous membranes are pink and intact. There's no cyanosis, so like bluing around your mouth or anything. Lips are a little chapped, but it's all right, it's winter. So there is no circumoral cyanosis, and mucous membranes, like I said, are pink and moist. And there is no pursed lip breathing, which also shows no signs of respiratory distress. All right, now I'm gonna have you shrug your shoulders. Good. And when you're breathing, there's no accessory muscle use. I don't see any jugular vein distension or anything like that. Now I'm gonna palpate your carotid arteries, okay? I'm gonna do one side at a time. Good, one strong. So is that one. And now I'm going to listen to your carotid arteries, and I will use this end of my stethoscope called the bell. When I do this, I'm gonna have you hold your breath for a second and then breathe, and I'll do the other side. All right, hold your breath. Okay, breathe. All right, hold your breath. Okay, there are no bruits or anything when listening to the carotid arteries. There is no thrills also that I felt. All right, now we're going to do the chest and the lungs. So I'm just gonna have a look at the shape of your chest. If you can sit up for me. Good, contour is normal. There's no abnormalities there. I inspected the contour and shape of the chest and evaluated the patient's breathing. She's not struggling with breathing or anything. I saw no visual abnormalities in the shape of the, sorry, there's my cat. In the shape of the chest, there's no barrel chest, signs of scoliosis, pectus carnitum or pectus evacuum? I don't know how to say that. And then there is no shortness of breath, intercostal retractions, or the patient is not tripoding, which is good. So now I'm going to palpate different parts of your chest, feel if there's any hard time breathing or anything. Just breathe normal. I'm gonna do the back side now. 4 on the front, 6 on the back. Good. I did not feel any lung vibrations or any abnormal lung vibrations in the anterior or posterior lung fields. Now we're going to give a listen to your lungs. So I'm going to go under your shirt. Is that okay? All right, so there'll be 4 spots on the front or 6 spots on the front that I'll listen to and 8 on the back. When you do it, I'm gonna have you take deep breaths for me, okay? All right. Breathe in. Keep going. I'll go to the side right here. Other side. Okay, and now I'm gonna do the back. Just keep taking deep breaths for me. Good, now I'm gonna have you lift up your arm for me, and I'm gonna check a little under your arm too. Good, do this side. All right, good, I don't hear any crackles, wheezing, rhonchi, anything like that. Lungs are clear bilaterally A and P, so that was good. Next, we're gonna move on to the cardiovascular part, so your heart. So I'm gonna look at your chest wall and see if there's any abnormal pulsations. Can you lift up your shirt real quick if you're okay with that? Okay. Good, there's something abnormal there. Awesome. So there's no heaves or abnormal heaves over the anterior chest wall. Now we're gonna palpitate it. So I do a couple different spots. I'm gonna find your midclavicular line. I'm gonna go down 2 intercostal spaces. Okay, good. Go over. I'm gonna go down a little. I'm gonna go right here. I'm gonna go under your left nipple. Good. Right here. Apical pulse is strong and well. All right, so I palpitated and there's no thrills or abnormal vibrations over the vascular areas of the heart. Moving on, we are going to auscultate. Again, so we're gonna listen. So I'm going to auscultate cardiac sounds using the belt and the diaphragm of my stethoscope over all different areas. And I'm going to see, and if it was a hard time hearing, I'd put you in the left lateral decubitus position because of like your breasts, but for this purpose, we are not going to. So I'm going to listen to your heart. Do you want to lift up your shirt for me real quick so I can get that? All right, just breathe normal. I hear S1 and S2, it's good. Good. So I do not hear any irregular rates or patterns, no murmurs or anything like that. The heart rate is strong and the rhythm is regular, no abnormal beats or skips, or gallops or rubs, and I heard S1 and S2 sounds very clearly. So next I am going to assess your capillary refill, in which you have acrylic nails on, so we're just gonna go through the motions and do it. So normally I press like on your nail and then look to see if the color comes back. But you have acrylics on, so we're just gonna do it very gently. And normal is if it refills within 2 seconds. If not, that's abnormal. So we're gonna say it is normal. We'll go ahead and do that since she has acrylics on. Next, we are going to check for peripheral edema. So any like swelling in your arms or legs. So I'm just gonna put light pressure. See if it indents or anything. Good, good, good. Do your legs. Good, good. Now do your feet. All right, I don't see any signs of peripheral edema, which is very good in either the left or right upper and lower extremities. Next, we are going to palpitate your pulses, or palpate. So I'm going to do your brachial, which is up here. Good. Do your radial. Both strong. Do your brachial on this side. Good. All right, now I'm going to go behind the knees to feel your popliteal pulse, which is a fancy name for behind the knee, or yeah. All right, what else do we have to do? Oh, posterior tibial, so we're gonna go right here. Good. Do dorsus. Good. We'll do this one. Very strong pulses. Very good. All right, and then normally we would also do femoral, so like it'd be right here, but for the purpose of this demonstration, we're not going to do that today. So the brachial, radial, popliteal, posterior tibial, and the dorsus pedis or pedis were palpated and symmetrical, and they were about 3+ in quality on each side and bilateral throughout. So there's my cat again. Now I'm gonna touch your skin to feel for any warmness or coolness, okay? So I'm gonna put my hand, back of my hand. Good, skin is warm. Surprising because it's usually cold.
Although I have children now.
This one's a little cold, but that's all right. And then you had pants on, so we're still warm.
That's a little bit cold.
Yeah, your feet are a little cold. That's a little cold. Yeah, that one's cool. Your feet, your lower extremities are a little cooler, but her upper extremities are good. All right, woohoo, table. All right, so next is going to be the last part, and that's going to be the abdomen. So can I have you lay down for me? That's why I put a little pillow there for you.
Okay. Oh.
I'm gonna move this over here so we can see what's going on. See how well we can see that. All right, good. All right, so we are going to, first, can you lift up your shirt for me? All right,
Yeah.
good. There's no distension or anything, nor abnormal contour. Stomach looks good. There's no abnormal bowel sounds that I can hear as of right now. There's no scars, no distended, no heaves or vibrations, anything like that. No bruises or prominent venous return or engorgement of the veins around the umbilicus, so that's good. And next, this is kind of different from all the other ones we did. We're gonna listen first before I touch, because we don't want to interfere with the bowel sounds.
Mm-hmm.
Normally you would listen to each quadrant for about 3 minutes, but for the purpose of time in this video, I will just do it, see if I can hear it. All right, just breathe normal, you're good. Good. All bowel sounds in all 4 quadrants sound normal, active, which is good, so they're not too going crazy and they're not too little. And so next we are going to also listen for the aorta, renal arteries, and iliac arteries. We'd also do femoral too, but we're not doing that this time. All right. Aorta would be like right here. Good, we'll do over here. All right, that was good. So I don't hear any bruits or abnormal blood turbulence or venous hums over the abdominal, aorta, renal, and iliac, and then also the femoral, which we are not testing for this. Next, I'm going to lightly palpate your abdomen, so just lightly, little motions like this. It shouldn't hurt, just let me know if it does, okay?
Mm-hmm.
Okay. Good. So I don't palpate any of the abdomen that's tender or distended, and I have not noted any masses while I was palpating, which is good. And the last thing we're gonna do, I'm gonna do percuss of your abdomen. So I'm gonna tap my fingers like this and feel for any hollow areas. Good, so I noted normal bowel intonation and performed percussion of the abdomen. All right, just keep in the hand. I'll grab the phone real quick. All right, and if you would like to sit up for me. I know. We're doing it at a table, it's all good.
I think I'm gonna go on this side.
Okay.
Come on this side.
All right, come over here. All right, so you are all good. I didn't suspect anything abnormal today with your evaluation. So thank you for coming in today.
You're welcome.
All right.